Ethical Perspectives on the News is produced by the Interreligious Council of Lynn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Good morning. Welcome to Ethical Perspectives on the News. I'm Bob Sessions, retired professor of philosophy, and your moderator this morning. In 1966, two sociologists, Richard Sennett and Jonathan Cobb, published The Hidden Injuries of Class, a powerful book that cataloged the many ways that being poor affects people. Their urgent pleas helped usher in the Great Society programs of the Johnson era, and since then, we've made further strides to address the many ways poverty harms people and thereby harms society. As many recent studies have shown, unfortunately, we continue to live in a society with great divides between the rich and poor, but also between the middle classes and the poor. Recently, we did an Ethical Perspectives program on how this unfortunate and unnecessary set of discrepancies between the haves and the have-nots has resulted in a striking increase in suicides and heroin addiction among uneducated, middle-aged white people. And we've also addressed some of the effects of an additional divide, race. Today we want to discuss how our ongoing unwillingness or inability to help alleviate poverty in America affects children. We will examine how poverty affects infant deaths, the health, development, and educational achievements of children, how the relative lack of success that serious poverty almost guarantees when they become adults, and the striking incarceration and early death rates of the poor. I hope we will also suggest some solutions to this embarrassing and immoral situation. This morning we're very fortunate to have three panelists who are knowledgeable about and who can help us think about these issues. To my left is Pramod Dwivedi, who is the Lynn County Director of Public Health.
Good morning.
Next to him is Crissy Canganelli, who is the Executive Director of Iowa City Shelter House, and Alan Fisher, retired Professor of Sociology from Coe College. Thank you for coming this morning. There's so much we can talk about, but let's begin by seeing if we can get a handle on just what some of the actual effects are on children as a result of poverty. And why don't we start with our sociologists who can kind of give us the macro view, the overview of some of the effects.
You mentioned many of them in your introduction, Bob, and I think those are extremely important, particularly infant mortality, which is vastly higher in this country than in any other post-industrial society in the world. Our infant mortality rate is a little more than twice that of Japan and Holland and several other rich nations around the world. Incarceration rates are 8 times as high among African Americans as they are among non-Hispanic whites. Educational achievement, of course, is very much lower. So there's a welter of effects. Increasingly, since the passage of the 1996 Welfare Reform Act, which imposed time limits and work requirements for the receipt of welfare. One of the key means of deprivation, this sounds almost circular, but I think it's important, is that deprivation of virtually any form of income is something that increasingly accompanies the lot of the poor. Of the 47 million Americans officially below the poverty line for a family of 4, which today is about 25,000. Of those 47 million poor, 15 million of those poor are children under the age of 18, by far the largest group among the poor. But one very disturbing development since the 96 welfare reform is that about 3 million of those 15 million kids live in households whose income is less than $2 per person per day. So since welfare reform, there's become a kind of bifurcation or division among poor families. On one hand, those who manage to get a job and to take advantage of the earned income tax credit. have been doing quite a lot better. Their lives are still economically marginal, but they're not nearly so poor as before. However, those who have not managed to get a job live lives of very great penury, even if you use the World Health Organization's indication standard of poverty.
I heard a billionaire today talking on TV about how the recession really is going on again. And he wasn't talking about the standard indicators. He was talking about for people who have not increased their wealth over the last 25 or 30 years, incomes have not gone up, and the cost of living has gone up, especially things like housing and so on. Crissy, you are our expert on housing. You run a marvelous home for homeless people in Iowa City that provides a variety of services. Why don't you tell us some of the things that you've noticed about how poverty affects those children?
Well, in the years that I've been working with Shelter House and serving our community and providing for people who are experiencing homelessness in our community, we've seen an ever-increasing number of families and families with very young children who are experiencing homelessness. So poverty in and of itself is one issue, but homelessness is at the extreme. Just in the last year, Shelter House served over 120 children. Our school district, though, by example, served over 470, I think, homeless children. So many children are living and families are living doubled up, and that's one category of homelessness. That's a very insecure housing situation because you've got one family who is renting an apartment and another who is just simply visiting for extended periods of time. And in fact, both families, everyone in the household, both households could be evicted with a 3-day notice. So it's a very precarious living situation, whether they're on the street, in a shelter, or living doubled up. And what we see is a great deal of anxiety and depression. We see children that are changing schools up to 4 times. Within a year. Even though our school district, we're very fortunate, the outreach workers, the liaisons work very hard to keep a child in the same school that they were in as they became homeless because they're trying to provide for that continuity. But the trends are, in fact, that the children their lives are very disrupted. They don't know where their next meal is going to be unless they are staying with a provider. But as you might well imagine, it definitely affects their health, their well-being, their sense of security, and overall leads to long-term challenges with depression and anxiety. And then, of course, the other issues that Dr. Fisher mentioned.
Mm-hmm. I think, the statistics is staggering, and it's very, very sober. 22% of our kids live in poverty, and we are the wealthiest nation in the world. So by any standard, moral, ethical, we cannot really qualify that 22% of our kids, and poverty has so many consequences, later in life. A lot of chronic diseases happen because of poverty. Emotional, physical health is impacted because of poverty. IQ is considered, decline in IQ also because of poverty. So I think, we have to look, and then you are looking at the racial ethnic disparity. That's also massive. About 38% to 40% African American kids live in poverty. 34% Hispanics, they live in poverty. 12% white kids live in poverty. So again, I think as a society we are failing. Until 2000, the poverty rate has been declining, but since then it has been increasing. And can you imagine that, even as the wealthiest nation on earth, on planet, we rank among, UNICEF actually published a report not too long ago where they said that we ranked 34th out of all industrialized nations. We were just ahead of Romania.
For
children living in poverty.
Oh, okay. Mm-hmm.
So that's really very, very sobering statistics. And I think as a society, we need to self-examine and come up with some sort of concrete strategies as to what exactly we need to do. We are, in bits and pieces, we are spending resources here and there, but I think there has to be some concerted effort politically that needs to be done.
I think it's important to echo your point that this is really not rocket science, both from our experience in this country and when we compare this country with other wealthy nations. We have a pretty good idea what needs to be done in order to address poverty and to lower it dramatically. There's an excellent book titled Growing Old in America by David Fisher, a historian, in which he talks about what life was like for older Americans from the Puritans to the present, particularly what it was like for older Americans during the Great Depression, when about 50 to 60% of people over the age of 65 were unemployed. Only 5% had pensions. He estimates that probably 70% of American elderly were economically dependent, either on state or local charity or on their families. And yet today, the elderly in this country have by far the lowest poverty rate of any other age group. As recently as 1959 and 1960, when my grandfathers died, the poverty rate among American elderly was still 35%. Today, it's a little over 9%. And as Daniel Patrick Moynihan, the great U.S. Senator from New York, used to say, the war on poverty that we really decided to fight, we won. That's a little bit of an exaggeration, but it's close to the truth regarding older Americans, with Social Security payments being made much more adequate, Medicare, wide anti-discrimination legislation, the Older Americans Act, and so forth. So older Americans have been the most insulated from the impact of the Great Recession.
Well, let's talk about children for a minute by maybe tracing. You can't overgeneralize, of course. Each child is going to be different. But
right.
what does the prospect look like through the life of a child? I mean, one of the ironies, I think, is that we have a huge problem with obesity in this country, and ironically, the poor tend to have a much greater problem with obesity, and that then leads to difficulty getting a job, keeping a job, getting diabetes. They don't have the well-being to, or the wealth to get medical attention. You see what I'm saying? And also the death age. My understanding is that African American males die at least 20 years on average sooner than whites.
Right, at least 10 years, yeah.
Yeah.
There was just a few years ago, there was a seminal study done by Centers for Disease Control and Prevention, and there was another organization. And what they did was they looked at 17,000 cases of kids. And the study is actually called Adverse Experiences in ACEs, Adverse Childhood Experiences. And what they pointed out in that study is that the more adverse experiences a child has, the worse off he or she is going to be as he or she ages, gets into adulthood. And it has such a profound impact. Chronic diseases, as you said, diabetes, as you pointed out, infant mortality, low birth, kids born low birth weight in poor families. Criminality, absolutely. That's really an incarceration rates, and that's when you look at the disparity, African American versus non-African American. How they are overrepresented in our justice system, criminal justice system. So there are series of issues, series of problems related to poverty as these kids try to become the productive member of society. And again, there has to be some sort of intervention, which is, as you said, it's not a rocket science. It's already, there are evidence-based interventions that we can certainly use to ameliorate this scourge, this problem, especially in a country which is so full of resources, so full of science and evidence-based practices, enormous brain power that we can transform anything at our disposal. But we have to ask this question, why we are failing our own future, our own kids. I mean, isn't there something that we should be doing? Welfare reform and all that. After all, we are really not doing very well.
Well, and in part looking at it too, what you're speaking to is the exposure of trauma. Children at an early age and the indicators of being exposed to trauma and the longitudinal impacts of that. And we see that, and that's only recently been talked about in the world of providing homeless services. If there's one common denominator, it's the exposure to trauma. But in talking about these things, what I see so frequently is that we talk about them as though they are contained and in isolation. And in fact, that as more and more of our children are experiencing homelessness or living in poverty, exposed to trauma, that impact isn't just felt by that child, by that family, by that individual household. It's by everyone around them. What is the indictment for the future of our nation as more and more children are growing up with the insecurities and the anxieties that are consistent with the experience of living in poverty? As they are in classrooms sitting next to other children, it affects everyone, and we're not talking about it in that context, the interconnectedness of all of us to this experience.
One way to put it, of course, is if we don't pay the cost when they're young, we have to pay the cost in spades as they grow, because the problems become much larger problems, as we say, of criminality, more expensive medical intervention, inability to work because they don't have adequate education or health, and so on. Yeah, well, what are some of the programs that you have at Shelter House to try to ameliorate this, at least with those particular people? I mean, we need obviously something larger.
It does need to be something larger.
Yeah.
I mean, we've got community-based programs and services that are intended to help people move beyond homelessness and help them to connect back to the community, get back and join the world of work. It's interesting. It's not difficult for us to help people find employment. We have a very low unemployment rate in Johnson County. It's trying to help people find jobs that pay a living wage. So it is not surprising that in the last 25, 30 years that as the poverty rate has increased and people's income has not kept pace with what living costs, it has been the entire structural change of our economy. We've gone from what was a manufacturing base to what is so completely pushed and driven by service sector jobs. They don't pay what living costs. To afford housing in Johnson County, I think the current housing wage is considered to be over $15 an hour. So we have people who are getting into jobs that are paying maybe $9 or $10 an hour, but they're having to work more than full time. Single parents who aren't able to then be everything and be home with their children and running to make both ends of the day work. It's a very bleak picture, and they don't have paid leave, they don't have sick leave. So we can do what we do to help connect people to housing and to jobs and to healthcare, and that is what we do, but we're not addressing issues at the point of where they're really generated, which is if you're getting people to work, allow them to earn what living costs. Stop subsidizing through welfare programs and making them dependent to be able to piecemeal their lives together. Expect the employers to pay more. We are, as you said, paying at one point in the equation. They allow people to make what living costs, and then we could see how that change. Do you know what I'm?
Right. So a living wage is one of the things you would suggest.
It's huge.
Yeah,
it's tremendous.
Just the distribution of our wealth has become so lopsided. From 1945 to 1973, the size of the American economy doubled and the average worker's wage doubled. Since then, the American economy has doubled again, but the bottom 60% have experienced really stagnant wages, which ultimately affects our children.
Right.
Sure. What about housing? I mean, obviously, much of the disruption in children's lives is when they have to go from
Substandard.
housing situation to housing situation. There's nothing, they have no neighborhood, they have no continuity, and so on.
And
How-
substandard housing too.
Right.
And how do you think we can deal with that?
Well, right now, just in Johnson County, we have over 50% of the renters paying, they're cost burdened, meaning they're paying more than 30% of their income on rent and utilities, and that's a standard that means that you're kind of getting into a precarious living situation. The majority of them are paying almost 50% of their income. So again, the correction being working to increase the living wage, because the market is not going to just provide housing at an affordable rate. We have less than a 0% vacancy rate in Johnson County. So it's very difficult for people who are very low income to compete with that market, and providing supports is also challenging and not necessarily efficient, but that is what we do because we're trying to constantly make up for that differential. And there's a great deal of research that says that when anyone is placed in their own housing, that housing is secure and safe, that they will be much more stable. I mean, it's intuitive. The children will consistently be in school, attend school, participate, stable neighborhoods, and the consistency and continuity that provides for the individuals and for the neighborhoods together. A great deal does come down to housing. And then that's also part of the differential and the impact with race, in so much as white America has had access to home ownership for decades, more than decades, than any other race in our country. We have had access to the ability to build wealth and to transfer that wealth onto generations. Well, there's an impact that's longitudinal that impacts across race lines. And it's profound.
One other adverse effect of poverty on children that we've talked about a little bit is environmental. I was struck during the discussion of the impact of the water situation in Flint to read an article in the New York Times a couple weeks ago saying that the percentage of children in my home city of Cleveland who have been measured as having dangerously elevated levels of lead in their blood is twice as high in Cleveland as in Flint. So it's a problem that kids experience, whether it be proximity to a toxic waste dump or whether it be poor drinking water.
And again, those are poor kids. I mean, they live in a substandard housing. The thing is that our health is really defined by the zip code in which we live. They predict, how long we are going to live because we live in a certain zip code. I mean, that's really outrageous, and that needs to be somehow worked on, somehow improved, that, any place you live, no matter where, you should be guaranteed to have basic, amenities of life and enjoy life.
Particularly since that kind of damage in the first 2 or 3 years of a child's life is often irreversible.
Irreversible, exactly. And some of our statistics or data is telling us that there are certain pockets within Lynn County, within our community, where a life may not be as rosy as elsewhere. So I mean, those are also where we live. That's also a challenge as a society for us.
Okay, so what are some of the solutions? We've talked about providing housing. How do you go about doing that? We've talked about providing health care, providing better natal care so that children don't die at such a high rate, and so on. How do we go about doing that?
I was only dimly aware before some reading I was doing for this program that Tony Blair, British Prime Minister, in 1999, initiated a major anti-poverty initiative with the goal of cutting poverty in half by the time he left office, and that drive succeeded. Poverty among British children at the time that he made that commitment was 26%. When he left office, it was 10%. So again, he simply expanded many of the programs, particularly for children, that already existed concerning health care, particularly concerning preschool. If there's no magic bullet, of course, for childhood poverty, but if if there were one, it would be high-quality childcare and preschool. So the achievements of the British under Prime Minister Blair, I think, can provide a kind of model for us.
Right, and I also think that linking the welfare with the job would be a good thing, because some of the families can be helped, and if they are helped, if their income level goes up, then the children can be saved from going through all kinds of stresses or stressors because of the poverty.
Although without a kind of WPA-like jobs program, I think that's easier said than done, because the welfare reform program in the mid-90s that President Clinton originally proposed had a combination of carrots and sticks.
Right.
And the sticks got implemented, particularly the requirements for how long you could be on welfare and whether you had to accept a job. The carrots, for the most part, didn't. That is, whether additions to health care, additions to child care, and so forth. So David Ellwood, the Harvard economist who is Clinton's point man on welfare reform, wrote an insightful article titled "When Bad Things Happen to Good Policy" when he left the Clinton administration, because it seems to me there's a need to simultaneously address both the carrots and the sticks. The sticks alone have not worked except in creating a large number of exceedingly poor families with children.
And I think that that this has a lot of political implications. We've only got a couple minutes left, but it seems to me that people who are conservatives tend to be right, and that is that people need to have skin in the game. People need to have a commitment and responsibility for their own lives and so on. My experience with poor people is most of them want that, okay? It's the lack of opportunities that create the problem. But certainly the connection between welfare and work wasn't a bad idea in that it brought those two sides together.
Well, particularly the fact that the Earned Income Tax Credit is, with the exception of Social Security, by far our most effective poverty program indicates that if you give people incentives to work, they will go to work and stay at work. So
we've got about 2 minutes.
Yeah, so Bob is here, moderator, and he has the right to ask questions. But can I ask a question? Tony Blair's model that succeeded, I mean, it cut childhood poverty by 50% almost. What were the strategies that succeeded there, and could we replicate that here? Given we have to have political will in order to do that.
And now you got about 1 minute.
Okay.
To sum it up.
I think if we could get over our Reagan-era taxophobia, we could implement many of the same things, particularly the massive increases in child care and preschool programming. That the Children's Defense Fund 2016 report on poverty among American children argues strenuously that a 2% increase in the federal budget would accomplish very much the same thing that the British model did. But if you look at the anti-poverty programs being suggested by Republican candidates today, it's quite discouraging, because Marco Rubio and conservative columnists like David Brooks have been saying, what we really got to do is block grant federal aids to states. And you say to yourself, have you been reading a daily newspaper for the last 20 years?
Well, Al, I'm sorry, we could have another program on the political side of all this. Appreciate your coming this morning, Al and Crissy and Pramod. Very much appreciated, and I think it's been a good program.
Thank you.
Thank you very much.